Good morning. Pat Ziemer here with Magna Wave. Welcome to the Magna Wave office hours. We come to you every Tuesday morning at this time, 9 o'clock Eastern, to answer your questions, whatever they may be, pertaining to Magna Wave, whether it be machines, training, other devices, whatever the situation may be. We want to answer your questions and see that you get the information that you're looking for in a very transparent manner. So I'm glad to be here with you this morning. If you have questions, post them in the chat box here on the Facebook page, and we'll be happy to answer them. If you'd like to call me, you can text me your name to 502-599-9722, 502-599-7722. Mute your speakers, and I will give you a call back. That way we can handle more than one call, because if you call in, I might get multiple calls, which has happened, and I can't get to everybody because I can only do one at a time. But at any rate, give me a call. I'll be happy to talk with you. If you have something with regard to Magna Wave, how Magna Wave has helped you this year, whether as a client or a practitioner, providing your business at this time of year, it's Thanksgiving. If you'd like to share what you're thankful for with regard to Magna Wave, whether that's improved wellness, improved business, whatever it may be, text me your name. I'll call you back and we can discuss that, and you can share your feelings as far as this holiday season is concerned. We're certainly very thankful for this being the Thanksgiving weekend. It's been a good year for Magna Wave. We've had a lot of people join us, and we have had a lot of people who have had very much success in their businesses, and that's always very rewarding when you look back and see how many people you've been able to help, whether we've been able to help them to be in business or be able to help them help other people. It's always rewarding to have that. For that, we thank you. We very much value you, our fans, you, our viewers, you, our practitioners, for being a part of the Magna Wave family. So I wish you a very happy Thanksgiving with you and yours this week as you celebrate the Thanksgiving holiday. So with that, I want to get on to a couple of things that I've been asked over the week. It seems like there's been a lot of different questions about how many amps the machines pull, what type of generators can be used. We always get a lot of those questions. I also have had some questions with regard to low power and high power devices that people use, and whether or not what is best for them. And probably the question that we get the most is, what is the difference between the low power devices and the high power devices like Magna Wave? Well, the primary difference is the power, and what that means is the speed of result. Any magnetic device, I feel, all the different devices, whether they're low power or high power, will provide good work for you, will provide good results. The difference being the speed that the results are attained. With the higher powered device, you don't need as long a treatment times, and you typically see a result quicker, or a more rapid result to what you're looking for. You'll have pain relief rapidly, that whole type of situation. And so with that said, there are many people that may have an indication that they want to use PEMF and a low power device would work. Just understand that it's going to take longer. And that's the primary difference between the low power and the high power devices, is the speed of result. Now, there are people that say, well, you don't need that high power to get it, and that's true. But it just again depends how quickly you want to achieve the results that you're looking for. Is there ever a case that someone would not want a high power device? That's a question I received yesterday. And, no, because high power devices are totally controllable. So it's not a situation where someone says, oh, you don't need that, or you can't have that, or you don't do that. You can take a high power device like a Magna Wave device and turn it all the way down to where it's delivering a couple of hundred Gauss, and you've got it turned down low, and it takes a little longer in that type situation, or it's more comfortable for someone in that type of power setting. So there's never been, that I can think of, a time when someone would not need or want a high power device. device because it is totally controllable. On the other side of that situation is low power devices will work, but if you want the fast results or you want the higher power, typically it's not available in a lower power device. So for us, we feel like that the possibility or the flexibility of the devices is greatly enhanced because you have the higher power available to you, and so that's what it comes down to. And certainly another question that comes with that is, are you taught what is the difference between microstimulation or microcirculation results and systemic circulation results? The lower power units, and this takes in many of the different units, the Eimers, the Ziemer, and to name just a couple that are lower power, and they talk about microcirculation. They also talk about microtesla or millitesla in terms of their power. So microcirculation would be that it's a lower powered unit and it doesn't penetrate as deeply into the tissue, so they use microscopic evidence of the capillary circulation, if you will, being enhanced with those devices, and then that certainly would spread. I mean, the more you do, the longer you're on the device because of the longer treatment times of the lower power, then you get more circulation result that you're looking for. Whereas with the higher powered machine, that will penetrate very deeply depending on the moisture content of the body and muscle tissue and so on and so forth. Numbers are all over the place, but anywhere from 19 to 40 inches are different numbers that are used as far as the penetration of the higher power machines, which is why we use them on large animals like horses, because we can penetrate deep into the tissue of the animal. Or a large person we can go all the way through the shoulder and do the muscle, the tendon, the cartilage, the bone, everything going through in that regard. And so with the higher powered unit, you get systemic circulation improvement immediately, whereas with the lower power units, it starts at the capillary level and improves the circulation from that point, and it takes more time to get it going in that difference. And so that's the difference between microcirculation and systemic circulation. They're both doing it. It's just one, it starts at the capillary level, and the other one goes deeper at the level of the system, the overall body situation with the circulation enhancement. It doesn't increase blood pressure, it improves blood flow, is another question that we always get or often get with regard to the devices. Does it increase blood pressure? In fact, these devices will help relieve and lower blood pressure. So those with low blood pressure or blood pressure medication, or people who have blood pressure issues, can find some relief utilizing PEMF to enhance their blood pressure to a point that it's flowing better and not as much pressure. So those are the kind of things that I get. If you have a question, send me text me your name, and I'd be happy to call you and have a conversation again about something you may be thankful for. Or if you have a question you'd like to have answered, it looks like we have a question on the screen. Are you comparing all PEMF systems to Magna Wave or Magna Wave machines to each other? Well, I can do both. I can kind of cover. It's a great question. I'm talking about Magna Wave and how it asserts to different power levels of machines. Now, to that end, when I compare the Magna Wave machines themselves, we have machines that we consider lower power Magna Wave machines that start with our semi device and go up to the max device. And I need to pull up, let me see if I can pull up those Gauss figures here and have a look at the Gauss figures and share that with you a bit. So we'll pull that up here with the Gauss readings. But so the Magna Wave machines start, the lowest power machine we have is the B2 device that averages 500 Gauss per setting across the device. Now, what does that mean compared to low power devices? Most of the low power devices that are on the marketplace, that would be again the Ziemer, the Eimers, and some others that are considered in that low power range, operate in the less than 100 Gauss of delivery. Again, all PEMF is good, but that is the range of Gauss that they operate at. The B2 machine, the lowest power machine that Magna Wave has on the website at this point in time, generates 500 Gauss compared to the 50 Gauss that some of the low power machines provide. So again, it's going to give you more energy into the area. And then you move along, the semi device will go anywhere from, it's got 3 different settings, so it runs from about 1,000 Gauss to up to about 2,500 to 3,000 Gauss, depending on the attachment that you're using. And then the semi has what is a background signal that goes all the time that is about 169 or 170 Gauss all the time, that's in the background underneath. Why is that? Because it's closer to the Schumann resonance. That's a lot of studies have been done at the Schumann resonance type of setting in terms of lower output or a lower frequency of delivery. So we just wanted to have that in there, so it's running all the time in the background on the semi machine. Also on the what we call the Wave Pro device, or it's going to be called the Vesta, and we're changing the name of that particular device, but on that device, and then the new Aries device, which is the step in between those two. A lot of devices on the marketplace, but basically our lowest power is the B2, then we go to the semi that generates about 3,000 Gauss, then we go up to the Wave Pro device that will become the Vesta, and it gets up to 5,000 Gauss. And then we go up to the Maya machine, which gets up in the neighborhood of 8,000, 9,000 Gauss, and then the Max that will go up in the neighborhood of 10,000 or 1 Tesla from there. Now we have devices that will accurately measure these machines. And when you start talking about energy between the machines, and I want to come back to better answer that question that was asked when I compare the Magna Wave machines, when we have a device that will accurately measure the Gauss of these devices. Up until recently, a lot of people would say, well, we deliver 2 Tesla or 3 Tesla or 4 Tesla, whatever the situation may be, but they don't have devices to accurately measure the machines. Why? Because most magnetometers are designed to read continual waves. In other words, a wave that starts and flows and doesn't stop. And so a magnetometer can easily track that and give you a Gauss reading based on a continual wave. When you start talking about high power devices, ringer devices or impulse devices like ours are, you get more of the wave starts and stops. So when a wave stops or a signal stops, the magnetometer doesn't know what to do, and then the next wave fires and the magnetometer is trying to keep up, so they don't give accurate readings. So we had to have a device made that was specifically designed to read high power devices, and so we can measure devices. And to that end, we're getting ready to become a member of and back the new association that's coming around, the Association of PEMF Professionals, which part of their deal is to bring standardization to the industry, so you can know, and they will be able to test, as we understand it, test particular devices and put all devices on a list, so you'll know what's accurate and what's real in terms of Gauss readings and energy delivered and that whole type of thing. So coming back, and again, if you have a question and you'd like to talk about something, give me a call. It's 502-599-9722, or send me your name and through a text, and I would be happy to ring you up. If you want some gear, I kind of liken the vest today. If someone wants to participate and they show us their thanks or whatever, or talk about a question they may have about Magna Wave, we have some vests. We'd be happy to share, the warming type of vest that you may like. Now, so that comes back to, again, let's talk about differences between high power machines and low power machines. As I was saying, most of the low power machines produce a sinusoidal wave, which is a continual wave that goes on all the time, and they're much lower power, often less than 100 Gauss of delivery, or even less than 50 Gauss of delivery as they set up their particular devices to provide energy to the body. Now those are called hummers because it's continual. the signal is continual. The higher power devices are called ringers or impulse machines, meaning the signal starts and stops, and so that would be called a higher voltage or a higher power device that delivers that type of signal and measured as I was sharing with you. And so that's the primary differences. We have different levels in our devices. Now, when you take our device and people say, well, I want the semi device, will it do what the max device will do? Yes, it will. It's going to take a little longer than what the max device will do. You can take a max device if you have an elbow issue or you have a problem in your hand, and you can put the max on there and treat it for 3 to 4 minutes, and you can have some relief immediately in that area. If you're using the semi machine, which is about half the power of a max for our conversations here today, that might take you 8 to 10 minutes in treatment to achieve the same type of result. And so what the higher power machines that we have provide is more option. For example, if someone is working with athletes, and being whether it's a human athlete or an animal athlete, a horse or a competition dog, whatever the situation may be, in many cases they want that relief immediately. They want to get on those joint issues immediately and provide the result. Or if they have abscesses that they're dealing with in horses, they want to get that result very quickly, then will use the higher power machine. It gives them more versatility in how I present that and discuss that with people, is the better versatility that's presented with the higher power machines. But the lower power devices will work just fine, but they are a little more limited potentially in that versatility that they will provide. Now, when you stop and think about that, and people ask this question, well, I have a sore back and I want to know what to do. Will the semi or the Vesta or one of the other devices work for me? Absolutely. You put the mat on your back or the coil on your back or your shoulder, and you put it on there for 10 or 15 minutes, and it'll do its job. Will you feel it as much? No. I mean, it won't be as strong as punch, but you will feel it and it will do the job. And that's another thing that I want to come back to when you talk about low power and high power. When you do low power Hummer devices, if you will, less than 100 Gauss, you rarely ever feel the machine operating. And people like to feel the massaging, if you will, the mechanical massaging of the area that they're working on. And most of the Magna Wave devices will provide that you can feel what's happening. With the higher power devices, you can feel it more, and you can be controlled from low to high. So you can turn that setting up quite high, and you be moving the area quite actively if that's what the person wants, or if that's what is needed to help get the result that they're looking for rapidly with the particular devices. So I'm going on covering a lot of space here when it comes to talking about the power of the devices. Again, if you have a question, text your first name to 502-599-9722, and I'd be happy to visit with you. And let's see, we have another question here, I believe. Saw a practitioner wrap her coils in vet wrap. I'm assuming to keep them clean. Just wondering, what's your opinion on this? Thanks. Actually, Amy, good question. You can do, so people do that to keep it clean. Some people have done that to make it more appealing to the animal. It's not as stark looking to the animal, so they can do that. The signal will go right through the vet wrap. The vet wrap's going to get dirty. The vet wrap will be harder to clean with regard to a cloth or something that you might be wanting to clean it with. So that's a personal preference. I know people have done that. Some people have wrapped it in a darker, a blue or a green or whatever color they want to do vet wrap, in order to, again, make it not as stark and maybe more comforting to, if they're doing horses or whatever they may be doing, to present it in that type of fashion. But certainly it does not hurt the effect that's provided with the device to do that, to wrap your coils in that fashion. Great question. If you have any other questions, folks, just put it in the chat box, and I'd be happy to answer them for you at this time. That is an interesting question. And also, to that end, when we talk about the power of machines, each attachment, each coil changes the energy of delivery. For example, the paddle is that we have provides the most energy when it is utilized, because that's the way it's made, that's the way it's wound. It's a pure Tesla coil. It's designed the way Tesla originally designed the magnetic field or the apparatus to be used. When you go to a loop, that's a circle that's being done, that greatly reduces the amount of Gauss or Tesla that is delivered utilizing the particular device. As an example, if you take a device like the semi, for conversation's sake, and if there's a regulation, for example, the FEI maintains that you can't use a PEMF device that produces more than 1,000 Gauss of delivery. Well, the paddle will deliver up to 3,000 Gauss of delivery with the semi machine, and the large loop, for example, will only generate maybe 790 Gauss or 750, 900 Gauss, in that range of delivery when it's utilized. The butterfly is different, and the large loops that we use to go over the shoulders or the hips of a horse produce even less Gauss, but they produce a lot of movement and a lot of massaging result or effect to the animal, because they're covering a large area of tissue, and you can get some good massaging result using the wave wings, which are actually producing less Gauss than the paddle is producing, but again, it is a large area of concentration, and so that's important to know when you're using a device. The main thing is you want enough energy to do what you're looking for, or to accomplish what you wish to accomplish as you're using the Magna Wave devices, or any device that you're utilizing. Questions, give me a shout. If you want to share this with your friends, please do that. I'd appreciate that if you would share it. They may have some questions that they would like to have answered, and be happy to answer those questions, whatever they may be. I'll be here with you as long as you have questions, or if I can help you with anything today. If not, then we'll move on. But let me take a look here and see. I was pointing out we had some other questions. Where'd it go? Come back here and see if I can pull that up again. The questions that I had received. Where'd they go? Oh, yesterday. Here we go. Let me see if I can. Well, I can't find it. Okay. Well, I can't pull it up here. Very easy to pull up those questions that I had, but they were dealing with the various power levels of the devices. So if we have any questions, please put them up there, and I'd be happy to discuss them at this point. Are there any other questions? Did I miss anything, Brad, that was up there? I got everything that people have put in. I know that there's a lot of people traveling this week, more stuff going on with regard to the holidays and so forth. We have several people with us today. I don't guess anybody wants a nice insulated vest, Magna Wave gear. If you want one, give me a call or send me a text. I'd be happy to talk with you. Tell me something that you're thankful for with regard to Magna Wave, and I'd be happy to get some gear for you and share that with you this holiday season. Okay, let's see. Let me see if I can find that list of questions. Here we go. Well, can't seem to put my hands on it. I don't know where it went. Oh, I know why I can't get it. It's in the other email. Here we go. Got it. It's in the other email, not the email that I was looking at. I was looking in the wrong email spot. Let's see. Training and certification, private practitioner groups. Do you have? Oh, here we go. Here's a call coming in. Let me text back. Let me see who that might be. Good morning.
Good morning.
How are you?
I'm good. How are you?
I'm great.
I have a question. I'm about to go work on a horse that had surgery for kissing spine.
Okay.
And I worked on him once already and got great results. I'm coming back. I just need kind of like a protocol on how often I should work on this horse to give him a better, results for this horse. Obviously he's already better, but I want to keep him going in the right direction.
Well, as you know, our basic protocol is treat as often and as long as function continues to improve. So in a surgical situation like this, when was the surgery performed?
It was performed, I think it was 6 months ago.
Okay. And so the horse is better, but they're still feeling like they want to have some additional relief?
Yes. Its horse still is sore there. And, he had him on rest and just started back riding, and he was still really uncomfortable. So I worked on him. He's never felt better. So I just want to, give him the best results.
Well, certainly you want to treat the area of the spine. You want to treat the overall body so you can have good blood oxygenation and all of that going through the body, through the spinal area as often as possible or as long as possible after a treatment. I would kind of I would treat the horse once in the manner that I was talking about and see how long they say it holds. And there's a couple of ways to approach this. If it's been a while since you've treated, what I would recommend is you go in and treat the horse 3 or 4 times in a row, or 3 or 4 times over a week, maybe every other day, over a week period of time, and then stop and see how long the good result lasts. So, and then come back and treat as often as necessary to maintain that. So you could get into a routine that the horse may need to be treated once a week, could need to be treated once every 2 weeks or once a month, depending on how long it holds. But typically, the more you do it, the longer it will last. And so it could be that you would treat the horse several times and then stop, and it may last a week or 2. And then you can come back and treat it once or twice, and it may last 2 weeks or 3 weeks. So that would be what I would do, is to see how long it holds. And but if it's a chronic situation, which obviously it sounds like it is, you're going to want to get after it a little bit, so get ahead of the problem. If you treat it once and then go back and treat it in 2 weeks, and you didn't totally get the relief that they were looking for, well, it's going to start creeping back in immediately. You know what I mean?
Yes, and that's what it's been. It's been 2 weeks because he's an hour away. So if I could, say, well, hey, bring the horse to my house for, a week and let me work on it every day, I'll offer that and see if that's something I can do. That would be a
great situation. You could offer them a package type deal, bring the horse to you, treat it every day, even twice a day if you wanted to get ahead of what's going on, and then see if maybe you can do it once a week or once every 2 weeks to keep everything in place. Great plan, great idea. I understand if it's an hour away, for you to go an hour each way every day is probably an issue. But believe me, if they say, well, let's do it once a week for a month or 2 months, that's better than not doing it at all for 3 weeks and then trying to do it once or twice and then not doing it at all. So some type of regularity would be what I'd recommend.
Okay, great.
Okay? Now, to get your gear, I need you to send your name and address information to support@magnawavepemf.com, and they will get you one of the vests. So you want to give them your size as well.
Oh, great.
Okay?
Okay.
Thanks for calling.
All right, thank you.
Bye-bye.
Okay.
There you go. Let me see. I think we had another, we have a text message here. Let me see who this may be. We'll give it a call. I believe. I hope this isn't a, let's see what we get. Could be a hello, you need to pay your taxes, or you need to stay out of jail, or whatever. We've all gotten those. Hello.
Yes.
Yes. You're on the air.
Hello. Hello, Pat.
Hi.
I was just calling. You had asked earlier about things that you were thankful for.
Yeah.
And it was occurring to me as I was listening to you that I'm really thankful for how much information you put out there for PEMF, that you make it not only open to your practitioners, which I am, one of, but for everybody, because that's something no other PEMF company out there does. I mean, if they do it to benefit, or at least what I've seen, their particular company for sale. And the fact that you put all this information, you, Elaine, the whole Aaron, everybody out there, it's just something I'm really thankful for. It not only benefits our clients, PEMF itself, but it's just something I'm really grateful for.
Well, thank you very much. I really appreciate that. And there's a couple of ways of looking at it. A couple of years ago, or actually about 5 years ago, someone came to me and they said, you're educating your competition. And I thought, maybe I need to pay attention to what I'm putting out there, because I am educating my competition in some regard. But what it really comes down to, and the way I've always looked at it, there's plenty of opportunity for all of us to help a lot of people, whether it's us or our practitioner or even the competition. Certainly we want to be good for our practitioners like you and the other folks that are out there. But really the important thing is to spread the value of PEMF. Let people see what the PEMF can do and how they can utilize it for their health and wellness. And that's really what it's all about. And I appreciate your thoughts tremendously.
Well, you're very welcome. And like I said, I appreciate all the hard work that you all do to put the right information out there to benefit people. I know it's benefited me personally and benefited a lot of my family, friends, and clients. And,
all right. Well, I appreciate that.
Getting the right information is great.
Okay. Well, I appreciate it. And be sure to send your full address and everything to support at Magna Wave PEMF and vest size, and we'll get you a vest.
All right. Thank you.
Have a nice Thanksgiving. Bye-bye. Ah, there you go. Somebody was thankful, and that is a good question that people have said to me. Why are you doing that? Well, we're doing it to be transparent. We want to really be accurate on the strength of our machines. We want to be accurate when we discuss PEMF in general. All PEMF is good. It's just depending on which one you want to use and what your needs are, and what's the best way to use it. And that's the important thing. So, and I appreciate her call, and I certainly appreciate the thoughts, but that's our deal, and that's my deal. I want to help people be healthier, and I get a lot of happiness doing that, making people feel better and live healthier lives, and that's what it's really all about. So thank you for the calls. I certainly appreciate that very much. Any other questions? Let's see. We have a question there. Jennifer asks, have you seen any benefits using poultice like Soar No More, while Magna Wave, and would it help the body absorb the poultice? Yes, to all of that. We've had situations where people have used a poultice like Soar No More, and there's a couple other products that are out there. I know that we have another call coming in. I will I will text them back and call them back in just a second. But to answer your question, certainly it will help the absorption of anything that's going on with the Sonomore type of product or other products that you're putting on. You can Magna Wave right over them. The only thing that we sometimes talk about is if you're doing something, Magna Wave helps cool the area that you're treating. And so if you're applying heat, if you want to apply heat to a situation for the results of heat, then that's good. Do that, but treat Magna Wave either before it or after it. There's just competition if you're trying to treat over something that is producing heat, because Magna Wave's trying to cool. It'll still work. It's just that why create the competition between the two products? Use them in concert the way they're best designed to be used. So that was a good question, and certainly you can do that. Okay, let's see. All right, let's see who we got here. Let me dial this number. And here we go. We'll see who we have. Thanks for sending a text message second time through.
Good morning, Pat.
Good morning. How are you?
Good. This is Erin McElmurray.
Hey, Erin. Happy Thanksgiving.
Hey, happy Thanksgiving to you. So first of all, I totally agree with the one of the previous callers saying what they were thankful for. I've been a practitioner with you since 2010, and you guys are just an amazing company.
Thank you.
So
you were one of the
appreciate
first.
All you guys do. Yes. I know. I think we kind of did I just feel like I was at the bottom of the, at the beginning, at the foundation. It's just really been awesome, learning and growing with you guys.
Thank you.
Really awesome.
Thank you. It's been fun working with you as well.
Thank you, and looking forward to the convention this year. Looks like it's going to be amazing.
It is.
So a couple questions. I have one horse that I'm going to go see today down in Indiana, and the customer thought at first that it was scratches on the hind legs, and then the hind legs started swelling pretty good, so she took her to the vet, which I did recommend, and the vet said colitis, and she's like, well, can we treat colitis? And I said yes, thinking that, colitis is kind of a stagnation of the tissue, and if we can get mobility in that, get increased circulation, reducing of inflammation, it would be good. Are you in agreement with that?
100%. 100%.
Okay.
The key thing there is itis at the end of the term. Anything with inflammation that's causing that issue, we're going to help relieve that inflammation, which can set the area up or the body up to better heal itself. Absolutely.
Very good. Okay, so I'll do that today. And then I have another dog. He's 12 years old, boxer. I've treated him twice a week for 2 weeks. He is twisty and wobbly in the hind legs. The vet one of the vets kind of thought hip dysplasia. When I feel roll my hand down the dog's back, I feel heat, basically like L4, L6. L4, L5.
Uh-huh.
And so I've been I scanned it, and that's where the machine said, hey, this is what we got to work on. So I've been treating that. Now it's interesting. When the dog walks in, he looks a little better. After I treat the dog, he is almost falling down. And what I say to the client is, okay, so I'm tapping on those nerves, I'm tapping on that area, so I'm basically waking it up and kind of disrupting everything.
Correct.
Which is why initially it feels worse. But then she's like, in a day or two, or not even not a day or two, but a day, maybe 5 hours even, the dog is better. So I told her, I recommended to her to continue, and she did also start going to a dog chiropractor, which I was like, great, wonderful. Let's get this, dog spine realigned, then hopefully the nerves and the tissue and everything comes back and you're good to go.
Correct. And
Okay.
I think you're right on. If it's got a situation, it could be an alignment issue that you get up there and you work on it, and the nerves are still being impingement or whatever the situation may be. That when you work on it, all of a sudden the dog is saying, "Oh my gosh, I got to figure out what I'm doing here," and they get a little wobbly. It's much like a deep tissue massage. If you go personally and get a deep tissue massage, quite often you're sore after the massage, but you feel better hours later. Now, and because the dog is wobbly, let's cover two things. Does not necessarily mean that it is sorer. It just may mean that the dog is having like you said, all this has been disrupted, and it's trying to get good blood flow and so on and so forth to go to the result that they get in a few hours. So it's like a deep tissue massage. You got to start things going, and then all of a sudden, bingo, they materialize to the result that you're looking for.
Got it. Okay. Awesome. Thanks, Pat, so much. I appreciate all you do.
Thanks,
You're
Aaron.
amazing.
You have a great holiday. Hey,
all right, you too.
Now be sure to send your full name and address to support at Magna Wave PEMF and your size, and they'll get you a vest.
Okay, I'll do that. Looking forward to it. Thank you.
Bye-bye.
Happy Thanksgiving.
Thanks.
Okay.
Great questions. Let's see. We have another one. That was that one. Okay. No other texts at this point. If you'd like to send a text, you want to share something with me or have a conversation about something, I really encourage you, if you have a question, to do that, because just like with Aaron and with Stacy before, Tracy, it gives us an opportunity to go deeper into the conversation and to talk things through a little. For example, like the dog that she was just talking about. A lot of things happen, and we want to look at how we approach it. And certainly we want the result to be immediate. We want the result to be immediate, just like you want it. But in some cases it takes a couple of treatments, or it takes a little time for the particular treatment to align with the health that you're looking for the particular animal. And so if you have any additional questions, please feel free to send me a text your name to 502-599-9722. Elaine's here with us this morning. Good morning.
Hi.
Elaine, how are you?
Good.
Folks, any other questions, send them through. If not, we have other things that we need to be doing here at 10 o'clock, so we have about another 15 or 20 minutes if you have questions. If not, then we'll let you get about your business and enjoy your day, and make a lot of people healthy and happy with their health and wellness as we go on. So let's see here. Any other questions? Is there a question there? Did Jennifer? Am I seeing a question? Let's see. My dog has the same issue: arthritis in her spine and a blown disc. I work on it every other day, and the only reason she can still walk, and it's just amazing. And quite often, as the veterinarian was telling Aaron, that maybe it is a hip dysplasia issue, but we have found that you kind of look around and you'll find things that are causing something, a referred pain that looks like a dysplasia type of thing. And that could also be a situation that she needs to treat the dog several times to get beyond the issue that it's having, and then get it to be more stable. Let's see here. Okay, let's come back. Open this one. We have a call here. All right. Let's dial up the number. Oh, I did it wrong. Okay, let's do it. Let's dial it correctly. Okay, here we go. Looks like it's Terry. Oh, is it calling? Didn't call. Let's try it one more time. Well, we're having the same problem that we had the other day. Let's try it on here. We'll use this one. See, we have backups.
The number you have dialed is not in service.
Oh.
Please check the number.
Oh, now my thing was talking. Let's try this. Let's do this again. Okay, here we go.
Hi, this is Terry.
Hey, Terry, how are you? For some reason, my other phone quit working, as it did last week also. I don't know what I'm doing wrong. But anyway, so you have a question?
So I have a best friend who has went through 6 surgeries now in less than 5 months. Every time the tumor comes back bigger.
Wow.
But they're always on the spine. Now he has lost mobility from his belly button down. He's basically paralyzed. So my question is, how often would we be able to treat him from his waist down to try to get circulation back down through there? Because now he's in the hospital right now with blood clots in his lungs, and they're saying it's coming from his legs. So clearly there's not a good circulation, and we don't want to keep going through this. So I'm just curious as to how often I would be able to Magna Wave from his midsection down.
Well, this is certainly, Terry, something that you want to clear with the doctor. The blood clots present an issue that needs to be resolved, so he doesn't throw the blood clots and have a heart attack or
They're putting
stroke.
filters in him today.
Right. They're doing what now?
They're putting the filters in him today, because last night they did a catheter with the drip on the blood clot to dissolve it. So today they're going to put the filters in so that the blood clots don't go up to his lungs.
Right. Okay. That's a good thing. So once that's accomplished and the doctor feels that that's under control, and you tell them what you're going to do, I would treat if you get that type of clearance. I would think you could do it daily.
That's what I was hoping.
Yeah, I don't see any reason with approval that you couldn't do it that often, which can help with the blood flow, the oxygenation, the inflammation. That hopefully would help control the tumor growth and that type situations. That's what they do with PEMF for brain tumors, for example. They've got a device called the Optune that they put on. That it's like a stocking cap that they wear. That's continual delivery of PEMF to help reduce tumor size and oxygenation in the brain to basically cancer doesn't like oxygen and so that whole type of thing. So certainly you'd want to make sure it's comfortable. This is a situation that a lot of strength won't necessarily be required, but you do want to get the energy into the area. And I would think, again, clear it with the doctor and so forth, I would think you could do something like that daily if you desired, or every other day as they progress, as much as necessary to get the improvement that they're looking for, if it's available.
Like, my biggest concern is with him not having feeling, and I have the max, of course.
Yeah,
not knowing how far up to go.
I would
because
do
of him
it.
Not having any feeling.
I would do it at a setting that I couldn't count. In other words, it's fast enough that I can't count it. You know what I mean? Yep. You can't count 1, 2, 3, 4, 5 clicks, or 1, 2. It's a situation where and you cannot count it. That means it's a more moderate to lower type of setting on the device, and that's what I would go for with that. Comfort is certainly the key, and lower in this case, if he has no feeling, is certainly better.
Yep, that's what I was figuring.
Okay.
I just wanted to make sure.
Yeah, no, I think you're good. Certainly, you want to make sure you get clearance and all of that with regard to the blood clots and what's going on there.
Yep.
Okay, doke.
Okay, thanks so much.
Don't forget, text your full name and address to support at Magna Wave PEMF and your size, vest size, and we'll get you a vest.
Okay, thanks so much.
Okay, Terry, have a nice Thanksgiving and a great holiday.
Thanks.
Bye-bye. Okay, great question. Good question too. We always appreciate receiving those types of questions and being able to provide some information. But certainly, anytime you have that type of situation, we always want to check before you do anything with your veterinarian or the doctor that you're dealing with. We're providing energy to the body as a supplementation to the body, and a doctor can approach that differently and take that from the standpoint of how they want to apply it to the procedures that they're using for the health and wellness of their client. And there's a little baby in the house, Cookie's in the house. She's a cutie. And bring her over here and say hi to everybody, Lainey. Okay. Here comes Cookie. Cookie's going to come in. Here she comes. Hi. Here. Here's the Cookie. Hi, baby. How are you? Cookie's in the house this morning. We always enjoy that. And let's see if my... Okay, so maybe I'll get my phone to work this time and see what happens if someone has something. Give me a shout, send me a text, and we will call you right back and answer the questions that you may have. Any other questions? No other questions? Okay. Well, we're about out of time. Certainly want to thank you for being here with us today. Thanksgiving holidays upon us. Have a happy Thanksgiving. We're thankful for you being our clients, our customers, our practitioners, and we certainly want to answer the questions that you may have. So join us next Tuesday for the next edition of Office Hours, and we'll be right back here answering your questions. Have a great holiday. Wave on, and have a great day. Thanks. Bye-bye.